Good afternoon. Thanks everybody for joining the session today. All right, we're going to get started. So I'm going to talk about how two companies, b.well Connected Health and Samsung, came together to meet the CMS Health Tech Ecosystem's pledge, Kill the Clipboard. Super exciting how it all came together. I'm Sarah Zawicki. I'm the Chief Product Officer for b.well Connected Health. And I get the super fun job of enabling a smartphone to really be that front door for healthcare and enabling data unification and aggregation for millions of Americans, right? Super fun bringing new to market features to the market that really improve the patient experience and reduce administrative burden and friction for patients. Ricky, can I share it to you to give a brief intro?
Absolutely. My name is Ricky Choi. I lead the digital health team here at Samsung Electronics America. I'm also a practicing clinician. You know, our vision at Samsung Health is about building a healthier future for billions through connected care. And so super excited to be here to share a little bit more about what we're doing to try to help decrease the fragmentation in healthcare.
Awesome. So I personally myself experience friction a lot, right? For the last 10 years, every time I've checked into my annual mammograms, I have been giving a clipboard. For all of my 3 children, their doctors' FOIA visits, I'm constantly doing intake, form after form after form. Even just last week, I was asked to email my lab results to my PCP practice because they couldn't share them interoperably, right? So this is not a rural or underserved problem. It's not an ER specific. It's just the fact, the pain point of the industry. So, you know, today, you know, you can go to a doctor's office and you might still be asked to fill out 10 to 20 pages of fill out forms. And you know these forms. They're intake forms, they're HIPAA forms, they're consent to treat, their no-show cancellation forms, right? And that's going to add 15 to 20 extra minutes to every patient visit. On top of that, though, that's going to add 15 to extra 20 minutes to the front office staff, right? Really unnecessary administrative burden, coordinating, checking coverage, scanning in documents. And in fact, still 83% of practices in the US are still on traditional paper and front desk office like check-in processes, right? And so CMS really understood this pain point and said, we want to modernize the healthcare digital ecosystem. We want to eliminate paper forms, reduce the friction, and put the power of healthcare data exchange into the consumer. And this is really where the CMS Health Tech Ecosystem Pledge came from.
So as Sarah shared, no one comes to clinic because they want to fill out forms. No one comes to clinic to fill out and answer the same questions over and over again. They're coming with real health concerns and needs. And I think this initiative is really important to address that. You know, we believe that health data belongs to the patient. That's the data that is being generated from medical records as well as data from technology at home, whether it be your wearables and et cetera. And so really excited to announce the work that we're doing together in partnership with b.well around this Clipboard initiative. And shortly, we'll be sharing a demo to show how all this comes together.
Yeah.
Now, I think that as we, you know, this capability then allows you to share the medical records with your doctor, your medical records, data from other sources like your wearables, and after the visit allows for you to be able to pull those records down so you can bring them home and helps you stay on track with their doctor's recommendations. Because at Samsung, we really our aim is to be a health companion before, during, and after the clinic visit.
Thanks, Ricky. I mean, and super exciting this morning, if you didn't see the announcement, Samsung sent out a press release that really shared they're really one of the first companies to demonstrate end-to-end patient experience within the Samsung Health app for Kill the Clipboard and conversational AI. And so how is it all coming together? So before I dig into the demo, I just want to give a super high level of what the process looks like and what we're going to show actually in this demonstration. So all within the Samsung Health experience, first, an individual can actually get their digital identity via Clear, right? An actually verified credential. That information is used then to search for medical records across national and regional networks, as well as direct EMR connections to help build that unified patient record without the person having to log into portal after portal after portal. When now with that unified record, they can query it, they can ask questions, they can prepare for upcoming appointments in a very contextualized, personalized manner. And the point about Kill the Clipboard now is all of that the longitudinal health record data is at their fingertips. So within the Samsung Health application, They can select which data elements that they want to share. They can package them up in a QR code that is attached to a smart health link that's basically an encrypted link that now when they visit their doctor's office, they can scan that QR code and immediately that doctor can access that record and it can become part of their EHR record, all without leaving the Samsung Health experience. So I'm going to actually show you how it all comes together, and it is a recorded demo, but it shows actually end to end and how this all came together. All right. So first, meet our persona, Allison Hackett. Allison is like everyone else. She's nearing 40, mother of 2 kids, right? And she really is proactive about her healthcare. She receives an invite from Samsung Health to basically use Samsung Health as well as her Galaxy Watch to help monitor her health signals in between her appointments. One thing that she can do when she's in Samsung Health, again, is create that digital identity. And here are the steps that it's going through right now for her to go through a clear workflow, a digital identity provider, with her cell phone number, with loading a government ID, taking a cell phone, and basically immediately getting a verified credential or an IL2 token, which she can use to then search for records. So what is happening behind the scenes here is that b.well is serving as an individual access service provider and now searching for Allison Hackett's records across, again, national or regional networks as well as direct connections. I'm just going to pause really quickly. One thing that it did show really quickly is that it brought back 3 of her records very quickly, within minutes, right? Without her having to go into portals and connect. This data that's coming in is really comprehensive, right? It's beyond ADT feeds, beyond CCDs. It comprehensively can go through allergies, medications, laboratory visits. And that's immediately, without her having to go into portals and basically using her verified credential to bring back that data automatically. Oh my goodness. AV help. I should have used a clicker. Oh, sorry.
No, you're good.
I apologize. I should have used the clicker, not used this laptop. Oh, Sasha.
We got it. We're almost there.
Okay, this is good.
Let's slideshow.
Okay. While she's pulling that up, because I totally did a faux pas here on the live demo. So the other thing that being connected to the network will do is also, within 24 hours after a visit, bring in a visit summary directly into the Samsung Health app, right? And so in addition to being able to prepare for the visits and seeing her longitudinal record, the one thing that I'm going to show in the next part of the video is how when a visit summary comes through, it's not a really long narrative full of medical jargon and abbreviations. It's really a visit summary that is in clear, personalized context for Allison to be able to understand. And itemized are actually the follow-up action items that her provider may want her to do. So if you think about multiple visits across multiple providers, this is a centralized location for all the follow-up actions that Allison needs to do, regardless of the provider. She may need to schedule follow-up tests. She may need to pick up a prescription, right? And so this is where the beauty of really having a longitudinal record within one application really unifies the whole experience. Okay. I'm not going to touch anything related to this now anymore. So again, bringing all the unified records, everything from labs, allergies, medications. There's the 3 connections that automatically came back from the network connection. And you can see all the way the detail of the level of information that's coming back. Really rich information, vitals, as well as wearable information that she can also connect, again, with her Galaxy Watch, her ring also, right? And as well as, again, within 24 hours after a visit is done, she would get a notification directly in the Samsung Health application to go see this visit summary. So again, nice personalized context, no medical jargon, and it allows her to be able to prepare for her next visit. right? Now, one thing that she forgot to do at this visit was ask her provider, hey, I take magnesium as a supplement. Is this going to have any drug-drug interactions with the medicine you just prescribed? Here's a seamless way that within the Samsung Health application, contextually relevant to her visit summary, she can ask a question about this medication supplement interaction, right? Ask it in her own natural language terms and get an answer based on the chat assistant and LLM to be able to understand, right? And so without having to ask a question in her patient portal, get the answer right there. The other thing that Allison is really, really mindful of is her heart health now. She's approaching that milestone age, right? So she's monitoring her heart rate pretty regularly. Something that concerns her, what prompts her to want to schedule an urgent care virtual visit, and she can do that directly in the Samsung Health application through Health Tap as well. Now, one thing that finding out at the Health Tap visit was she was recommended to see a cardiologist. Now she's preparing to actually visit the cardiologist, and here's where she wants to select which data elements to share, attach it with her insurance information, and generate this QR code. So this is CMS's Kill the Clipboard in action. This QR code then she takes to the cardiologist's office, and that front desk can scan the QR code and seamlessly be able to upload her international patient summary into the Athena Health record, right? They can pick a disposition for the type of document, and this becomes part of her record. And it brings in all the laboratory, the medications, the allergies, in addition to the wearable device data from her Galaxy watch, as well as her ring. So if you think about like this blend of really being able to bring wearable data and mixing it in really to be able to have informed decision-making by the provider for her clinical and her treatment purposes, that is the whole point of Kill the Clipboard, right? No forms, no faxes, right? Just seamless exchange, really all in the control of the patient. And there is the wearable data. Yeah. So super exciting of really being able to showcase this end to end. I wanted to kind of just share and ask Ricky a little bit of your perspectives on this. This is like a milestone, being able to demonstrate this. Lots of parties coming together to demonstrate something real and meaningful in a really rapid way. So maybe one of my questions is, do you think consumer brand companies are either better positioned or more equipped to rapidly innovate, maybe even beyond traditional care and traditional health tech?
Well, we all know how fragmented the patient experience is in the health system. It's really fragmented for doctors, even more fragmented for patients. But just hearing the interest, the demand, the yearning on the part of consumers to look for solutions to their health problems is extremely exciting. And I think it's important for us to start to look at these consumer technologies to help solve those problems. I think there saw a lot of leadership from the part of CMS to say, look, we need to start really addressing the needs today and not waiting, and waiting for some of these bigger, IT as well as hospital systems to try to solve it for us. And so we're making that push together.
Super exciting. Now, one of the use cases that I brought through in the demo was this use of wearable data, right? I mean, Samsung obviously taking the step for really different types of signals between irregular heart rhythms, right, and kind of out of ranges. What do you feel is really the opportunity there of blending wearable and lifestyle data that is, happening in between doctor's visits, and how it actually can be used in clinical care with the actual clinical data?
Yeah, I think the challenge as a clinician is that I don't know a whole lot, in a lot of detail, what happens before the patient comes and what happens after the patient leaves. Now, while I'm interested, just because I want to be a good doctor and I care for the patient about what happens, but many times I may even be at risk if I don't know what's coming in the door and I'm confident about how the patient will do after they leave. I think these wearables we've gone a long way from just counting steps. Now have FDA cleared features, sleep apnea, atrial fibrillation, all these other areas, increasingly adding value in terms of a health and healthcare perspective. And I think we're going to continue to see this convergence. And so as we look to AI, for example, providing summaries, helping to kind of start to put together this narrative that comes from what the patient's experience is, their story, the data they've been collecting at home, and putting that side by side with the medical data and what's been recorded there, it gives a fuller picture, a more comprehensive picture of the patient experience and how they're doing in their disease journey.
Yeah, very, very interesting. Do you have any kind of predictions of kind of what's next in intelligence and health intelligence?
Yeah, I don't think you can like go very far, in a conference like this without starting to talk about agents. And so we're all this kind of when we talk about LLMs, it talks at you, but the agents will be doing things for you, and then you have agents monitoring other agents. But I think that now the healthcare systems are increasingly starting to get smart about this, trying to figure out how do I tie this back in. There is a lot of risk as it relates to AI, and health systems are very low risk institutions. And so it starts to show up more in back office sort of things, to make sure the billing and medical errors, that sort of thing. But we'll increasingly, I think, see it in the way that we interact with patients as well.
Very, very exciting. Very exciting. Well, again, thank you everybody for joining today's session. We hope we really could demonstrate how when health records move with the patient in a very secure and a trusted manner, then we can really address safety, quality, efficiency simultaneously. And that really is really the mantra behind the CMS Health Tech ecosystem. And we're super excited that we partnered with Samsung to be able to demonstrate it live. Please join us at the b.well booth later this afternoon. I will actually use my phone to showcase this live. I won't be Allison Hackett. It will actually show my data. I can show you a QR code and show you live and answer any other additional questions you may have. But thanks for joining us.